As the representative, of course, of Leicester East, one of the most diverse constituencies in the country, it has been extremely concerning to see the disproportionate impact of the coronavirus upon African, Asian and minority ethnic communities. This was proven, of course, by the government's own report, which they shamefully only published after repeated pressure and which does not outline any protective measures to deal with the disproportionate impact of COVID-19. You see, I worry in a constituency like mine, which has a significant number of people from the affected communities. I worry about the processes of tracking, testing, and so on, and whether or not that will be put right. Because you can imagine, if there was a second outbreak, what that impact would have on constituencies like mine. We already know that the Office for National Statistics found that black people are 1.9 times more likely to die than white people. People of Bangladeshi and Pakistani descent are 1.8 times more likely, and people with Indian descent around 1.5 times more likely to die. These figures reflect the severe racial disparities in our economy, of course. We already know from the Resolution Foundation think tank that estimate that black, Indian, Pakistani and Bangladeshi employees experience an annual pay penalty of 3.2 billion. The analysis from Public Health England showed that once in hospital, people from African, Asian and minority ethnic backgrounds are also more likely to require intensive care. So these communities accounted for 11% of those hospitalised and with COVID-19, but over 36% of those admitted to critical care. Many have tried to dismiss the imbalance in deaths as being explained by cultural or even genetic factors. I've been dismayed by some of the information that has come through my inbox about what people need to do to tackle these genetic problems. Yet discrimination is not about that. It's deeply ingrained in the social, political and economic structures of our economic system. The scourge of institutional racism results in unequal access to quality education, unequal access to healthy food, unequal access to livable wages and affordable housing, which are the foundations of health and well-being. This is the context in which the coronavirus crisis is operating. The virus itself may not discriminate, but our economic and social system certainly does. Existing racial and class inequalities, coupled with inadequate government support, mean that working class communities, migrants and African, Asian and minority ethnic communities are at greater risk and exposure from COVID-19. The severe racial disparities in our economy mean that these communities are more likely to fall through the cracks in government's financial support and therefore more likely to be forced into work in unsafe conditions. A decade of cruel austerity has deepened the racial and class inequalities that exist in our society. Last year, we know from a Special Rapporteur report for the UN Human Rights Council that when they reported on discrimination in the UK, we know that its grim findings reported, and I quote, "Austerity measures in the United Kingdom are reinforcing racial subordination."